Hi everyone. Thank you for your interest in this 10-minute educational video about sepsis management and rehab. There was a pre-video survey that many of you completed, which is much appreciated. If you have not taken that survey, please pause the video and scan the QR code, and please take it before you watch the video. It should only take about 5 to 10 minutes to complete, and there will also be a post-education survey with QR code at the end of this presentation. My name is Eric Anderson. I'm a PM&R resident, and this is part of my QI initiative to improve early detection and management of sepsis at the rehab hospital. Our rehab patients are often medically complex. They may be recovering from surgery, infection, or a prolonged hospitalization, and all of these factors increase their risk of sepsis. Sepsis is known as a leading cause of hospital readmission among rehab patients. There was a study at a 52-bed rehab facility, much like our rehab facility, that found that 36% of all hospital readmissions were due to sepsis. Sepsis is not just an infection. It's actually defined as a life-threatening organ dysfunction, which is caused by a dysregulated host response to infection. So the body's normal defense response goes into overdrive, damaging its own tissues and organs. So you don't need a positive culture to suspect sepsis. Recognition is based on clinical signs and symptoms. So key takeaway from this slide is that sepsis equals infection plus organ dysfunction. Who is at risk? Mainly, it's going to be patients over 65 years old, those with chronic illnesses, patients with indwelling lines or catheters. This could be Foley catheters or central lines or ports. And another big one is immunocompromised patients. So either as a result of their inherent disease process or if they're getting steroids as for treatment, this is going to decrease their ability to fight infections effectively. So early signs and symptoms that we should be aware of, this is going to be vital sign changes. So as far as their temperature, they're either going to be febrile or could also be a low temperature, tachycardia, tachypnea, new confusion or lethargy, low blood pressure or MAP less than 65. This hypoperfusion is going to result in cool mottled skin or even a flushed skin. It's also going to result in their kidneys not having as much urine output, so a decreased urine output. Several tools exist to screen for sepsis. However, it's the Q-SOFA, which is recommended by the Surviving Sepsis campaign. The SIRS criteria is no longer recommended for bedside screening, so we're going to be using that Q-SOFA score there. So there are 3 simple criteria: it's respiratory rate, systolic blood pressure, and mental status. So if the respiratory rate is above 21 beat breaths per minute, this gives them a point. If their systolic blood pressure is less than or equal to 100, gives them another point. And then if they're having new mental status changes. If the patient meets 2 or more of these, they are at a higher risk of poor outcomes, and so we should be escalating care as soon as possible. So just to review, so we're looking at 3 things. The quick 3, it's fast breathing, low pressure, and confused thinking. Those are the things we're looking for. We want to be able to recognize hypoperfusion. This can result in that organ dysfunction we were talking about earlier. So these are things like decreased urine output, cool extremities, and mental status changes. There's also a lab that can be used to monitor tissue perfusion. This is lactate. If this is above 4, this means that tissues aren't getting enough oxygen, even if the blood pressure looks okay. This is not something we often use in our rehab setting because we're a standalone rehab, and it takes a few hours to get even stat labs back. So it's just something to be aware of that you may see in other hospital settings. The first steps to restore perfusion is to give IV fluids. Sometimes it can be confusing because you want to give antibiotics because it's an infection. However, if they're having reduced perfusion, that's the first thing we want to fix, is giving them fluids to increase their blood pressure, because that's going to be the quickest fix. Antibiotics are going to take some time to set in. So if a patient is hypotensive, we're going to give usually a liter of IV bolus fluids, normal saline. That's the test answer. In real life, the actual volume may vary, so they may get just a 500 cc bolus depending on that particular patient. Fluids are the foundation of restoring perfusion. Only after fluids are given, if the blood pressure still remains low, are we starting to think about vasopressors. And if we're getting to that point, we're going to be transferring out of our rehab hospital. But let's talk about that a little bit. So the first line, vasopressor after fluids, is to give norepinephrine. And then if that's not being effective and the MAP is still low, we're going to give vasopressin. And when I say we, I mean the acute hospital. Common sources of infection. This is in all hospitals, but especially in a rehab hospital for patients at risk for pneumonia. It's going to be patients who have dysphagia or limited mobility. UTIs are another big one, especially if they have a Foley catheter or recent Foley catheters. And then wound infections. This could either be pressure injuries or surgical sites. So here at the Honor Health Rehab Hospital, nursing completes a sepsis screen every shift. And we just want to review here the steps to take if a screen is positive. So first thing, we want to notify the on-call physician or resident immediately. Then we want to reassess vitals and oxygen levels. Ensure IV access. This is important, especially if they're having that decreased perfusion, so their blood pressure is low. We definitely want to get IV access going, and then we're going to start to get the fluids ready to give an IV bowl. Then we're going to continue to monitor. Even if you're unsure that this patient is getting septic, it's best to err on the side of caution. So nurses are often the first member of the healthcare team to recognize changes in our patients, and it's your timely actions make a huge difference because the sooner we can start sepsis management, the better chance for survival and better outcomes. So our goal with this education is to increase our collective knowledge of sepsis and what to recognize in order to improve early detection. And subsequently, we hope that this can reduce sepsis-related transfers and keep our patients on track towards functional recovery and hopefully not end up back in the acute hospital. At the end of this survey, there's going to be some open answer questions that you can use to write down any perceived barriers to sepsis management and recognition at the rehab hospital. So I encourage you to use that. There's some key takeaways from this presentation that I want you to know going into the post-survey quiz. Sepsis is a dysregulated response and organ dysfunction as a result of infection. We're going to be using the Q-SOFA scoring, not SIRS. Lactate can also be used if it's greater than 4, that's a red flag. Treatment is going to be fluids first, and then if that's not working, then norepinephrine. Infection sources, we're thinking about the lungs, the urinary tract, and skin. Appropriate antibiotics are important, however, it does not come before fluid resuscitation. In reality, they may be given at the same time, but just know that giving fluids is the most important step. So thank you all for your dedication to take care of our patients and your participation in this project. Your knowledge, your vigilance, and teamwork is all essential to keeping our patients safe. So I appreciate you. If you have any questions, please reach out to me and I can answer any questions or get you to the right person. So together we can make early sepsis recognition a consistent part of our excellent rehab care here at Honor Health. Please take this post-survey using that QR code there. And I really appreciate you guys participating and look forward to seeing you all soon when I rotate there in a few months. All right, take care.